example lang, yung post-pandemic, pre-pandemic, and it really changed the landscape. No, right now it's the proportions of the crisis of mental health in children. Before that, di ba, panahon, maybe my generation, it's taboo. Mental health was very taboo. And then children were not encouraged really to share their feelings. We had them to control it very well, and then very structured ang school natin. So I would like to explain about school also, kasi alam mo yung schooling, yan ngayon ang nakakapag-stress sa ating lahat, sa mga anak natin, and definitely sa atin rin, mga parents. So let's categorize them, ha. So right now, children, this is like a 0 to 11. Okay, when you say adolescents, that's 11 to 19. No, so ang children, mayroon pang early, mayroon pang middle and late childhood. Ang adolescents may call this. We can look at it in terms of their relations to the present environment. Okay, so we can even make it a pre and pandemic and post-pandemic. Specifically, okay, so in children, we will think about when we go to school, yung sa school, maraming mga hyper, mga disruptive, di ba? Nakikita natin sa clinics ngayon, how will we control their behavior, the teachers. The adolescents is more of mga inattention problem, wala daw silang mga motivation. These are very common na nakita natin sa outpatient. Definitely, they will complain about school, ang performance tasks nila, sobrang dami, nasa stress sila, na ang coping nila ang affected. If they have good coping, and then maybe usually modeled by the parents, then that's very good, because we should not show them that adolescents is we have to protect them from frustration. In fact, we show them how to tolerate it. If there is bad coping, that's when you see cases of self-harm, yung mga naglalaslas na very common na ngayon. And mga suicide, also unfortunately very common. This is for all parents, and sometimes parents who are not there, because we have a lot of kids na the parents are abroad. So that's another. So yung mga caregivers and other relatives, these are tips for that. First is ask first permission to talk. Whether you suspect something that's going on or something that's not going on, just ask permission, anak, or can I talk, or can I ask you something? That's the first one, ask permission, because they may not be ready. If they're not ready, that's okay, as long as they know you're around. Okay. Number 2, when they do talk, you welcome it and you listen. And I mean listen. Listen, and just listen. Yeah. We have to restrain ourselves from trying to give advice right away, because premature advice, when it's not asked for, it's useless. In fact, they will say you invalidate them. So after you listen the whole time that they need to be listened to, then you validate. For you, as adults in the millennial or in the Gen X, we may not think it's a problem. But for them, it's a big problem, because it depends on their development, right? The struggles they are facing will make them mature, but maybe they're not equipped yet to deal with that problem. We must validate them first and know that, yes, you're having a hard time. Alam ko, mahirap yan. Parang walang solusyon. But I'm here. If you need to talk, I'm here. And following that, you ask permission to share your advice. Anak, I'd like to share. Gusto mo bang pakinggan yung side ko? Okay? At this point, be objective about it. Okay? And another advice, try to resist giving your own experiences in your own life unless they ask for it. Because if you do that, nagiging about you. So most of the time, you share your life experience, yung panahon ko, itong ginawa ko, so on and so forth. And they will not appreciate that, because it shifts to you and not to them. But if they ask, okay, what did you do? Then by all means share. And finally, you let them solve their own problems with your minimal supervision. Because you earlier mentioned that how come yung problem ngayon is so simple, but kids seem to overly react, right? It's most of the time is we are helicopter parenting at times. No, when we do, first we keep them safe, and then after that, after keeping them safe, like this is the pandemic, and after the pandemic, it's another adjustment, right? And then we want to protect them again. So we must not helicopter parent. We must allow them to figure out how to resolve their own struggle, because that's how they will get ego maturity. So let them figure out a way, let them problem solve, but they know that you're always around, to supervise. And if they need your help, they're always there.